All right, guys, welcome to another very entertaining and informative broadcast by Dr. Ranjan MahaJan from MahaJan Medical Center. I'm a board certified internist, and today we have our nurse practitioner Jordan with us to discuss the benefits of exercise and how it can impact mental health and physical health. So we are very excited because Jordan, has tons of experience with exercise over the years, as she is a great exercise coach, along with her, personal fitness. She has a good communication style. So we're going to get Jordan in a minute. Just wanted to also talk a little bit about the uptick in the COVID-19. We'll do later after we get Jordan, doing her bit first. All of you guys which have been coming to our live stream, we are thankful, and give her a, some love, give her some wow, and give us thumbs up. If you like Jordan, give her 2 thumbs up and give her some hearts. So let's get Jordan on the screen, and we'll take it from there. Hi, Jordan. Can you hear me?
Hi, guys.
Okay. So tell us about how you got interested in the exercise. Which age you started doing exercise?
So I always loved to exercise since I was very little. I always loved to run around outside and play kickball. I started dancing when I was 2, so I've been doing that now for a long time. And also I played soccer since I was young, so always just very active. And when I finished high school, that's when I really started getting involved in the gym and doing more gym-related exercising.
All right. So how long you been with the best medical center in the whole wide world now?
Almost 4 years.
Oh my God, time flies, time flies. I was talking to our office manager, Debbie, and she put your profile yesterday that you'll be coming. Boy, you got a lot of fans, Jordan. You're a rock star. We have like 25 shares, and our Facebook page lit up. We should get you more frequently. All right. Um, Let me ask you this. I know you have put a PowerPoint. So, guys, if you have not already looked at it, look at Jordan's PowerPoint on the Facebook. So, why you think we should talk about exercise to our community and patients?
Exercise is very, very important. I think it's one of the first lines with healthy eating for treatment. So whether you have diabetes, whether you have hypertension, anything, exercise and diet are always the first answer. So in starting early, getting a routine and implementing it early on and making it a habit is very important. I feel like it's the answer for any kind of diagnosis to get exercising because it helps mentally, physically. So
That's a great answer. I think, in the COVID situation, the anxiety level is so high, and it's fantastic that if people can exercise, it will, release more endorphins and help them with the anxiety which they're dealing with. Plus, they will do something good for the immunity. God forbid, even if they get the COVID, they will have better outcomes if they are exercising. So that's great. So I think you told me that you got a high intensity interval training and some stretching routines.
yes, I
Uh,
do.
okay, so walk me through what your program going to be. You're going to start with stretching, teach our patients a couple of good stretches. Uh,
Yeah, so anytime you work out, you always want to warm up and stretch and get your muscles moving before you start because you don't want to you want to prevent injury. So it's very important to warm up. And also, I brought water. Make sure you have water because you need to have water while you're working out. So that's important too. And then I also brought my phone because you need to have a timer for this workout.
Okay, great. We got a fan here for you. So I got him right here. Fred is saying, Jordan, you rock. I agree. Fred, thank you for tuning in. Jordan do rock. We are so lucky to have her in our medical center. So in terms of the program you're going to do today, you're going to do stretches first, correct?
Yeah,
And
we'll
then,
do stretches.
go ahead.
Yeah, so we'll start with a couple of stretches, and then the workout we're going to do today is called HIIT, which stands for High Intensity Interval Training. So what it does is it gives you a burst of workout. It's really good. It's a really good cardio workout. So we're going to do that today, and I picked 5 different ones we can do. We're going to do them each for a minute. If you're just starting out, though, I would recommend resting in between each one. I'm going to go through it just so I can show you them all today. But it's a good idea to do it for a minute and then rest like 20 to 30 seconds before you start the next one. And then when you get better, you can repeat this 2 or 3 times through, and that will give you a 15-minute workout.
Great. So, if you guys have comments, please do give Jordan some love and put some comments in the comment section, and she can answer your question about exercise. Mark is saying her sound is not very good. Maybe push it, closer to your, so let's try that. Okay. Thank you, Mark, for, giving us the feedback. So you want to get started with the stretching first?
Yeah,
okay.
Sure. And I do have this microphone and little pack on me, so I'm going to try to do my best when I start the exercises with that. But if it's all loud, I'm sorry. Okay, so I'm just going to do a short warm-up. I love warming up and stretching my body, but for today, I'm just going to do a short one. And we're going to start with head tilts. And with that, you're just going to put your head to shoulder, and just get your neck warmed up.
That's a great way to start. Yes, neck is important because, that's as we get older, that's one area where, there's a lot of load of the head as we are doing a lot of computer watching. So warming up the neck is very critical. So thank you for starting with that, Jordan.
And then also for the neck, I like to do the twist. So you just look side to side. And then the next one I like to do is shoulder rolls, and you're just going to roll them back 5 times, and then front 5 times.
So 5 times in the front, 5 in the back for the shoulder roll. Hey guys who are watching, do it with her. That way. Plus, the video going to be on YouTube and Facebook Live, so you can watch it later as well. But do practice with her and do give her some love. Jordan put a lot of work into coming up with this routine, so give her some thumbs up and wows, and we'll get started on the next stretches. Okay, so you got shoulder, you got neck covered, and now you're covering the shoulder as well again. Okay, go ahead.
Shoulder and arm, and while I do this, I'll usually, I don't know if you can see my feet, but I'll also roll my ankles to get my ankles warmed up. And then I'll stretch it behind. And then I switch sides, and I do the other ankle also. And then behind. And then I also like to stretch my side out here. And then reach over. You should feel it all here on your side.
Great.
And then the other side. And then to stretch the quad, I like to grab the back of my foot, and you'll feel it pulling. If you need to hold on to a wall or a chair for your balance, you can do that also. And then for a hamstring stretch, you're just going to reach down. And your goal is to be able to eventually put your hands flat. But you just reach as far as you can. You don't want to hurt yourself, so just go as far as you can.
Good.
And then I also like to stretch my calves out. So all you do is go on your heel and grab your top of your foot and pull it back. Because we're going to do some jumping, so you want to get your calves stretched out too. And that's it. That's just a short version, but that'll get us a little warmed up.
That's great. You got pretty much every part of the body covered, and I think the warm-up is critical to prevent any injuries. So I'm happy that you are introducing everyone to that part. So let's get started with the high-intensity interval training.
Okay, I'm gonna grab my phone and have the timer. So I'm gonna do each exercise for a minute long, and I'm gonna do it straight through, but make sure you do rest when you do these, okay? The first one is gonna be jumping jacks.
So that's easy, yeah. So as Jordan said, we can make it more anyone depending on their expertise level, you can make it less and more. And she's teaching you 5. Yeah, go ahead.
If you modify, you can do this. Step out.
Right. So depending on your, how bad is your knees and hips and your ankles, you can modify it too. So that's the first one of the 5 she's going to teach you on the high intensity interval training.
5 seconds. Okay, and then the next one is going to be mountain climbers. So for this one, you're going to go into a plank, and you're going to bring your knee up to your chest, and you're going to run in place.
Yeah, that's a great workout for your get your heart rate up too. So that's not only helping your leg muscles, your core, your heart rate is up. That's a fantastic workout, the mountain climber, Jordan.
It's good to play music too when you work out, because that gets you pumped up and makes it fun. Pick your favorite kind of like upbeat music. Seconds.
Great job, Jordan. That's fantastic. It's not that hard. So those are 2 great workouts for, to get started. Maybe take a break in between, correct?
Yep. Mm-hmm.
And
the next one we're gonna do is called ski jumps. And
okay.
Kind of looks like you're skiing down a mountain when you do these. Okay, ready? And you're squatting down when you jump.
Oh, wow. So you're squatting and you're jumping. So that's a great workout.
I'll show this side.
So that's the 3rd in the routine. So you got jumping jack, and then you got the mountain climber. Now you got the ski with the ski motion along with the squatting. Great.
Mm-hmm. I also like to wear my watch because it shows me my heart rate, so I can keep an eye on my heart rate when I'm working out.
Yeah, that's a great idea. Getting the heart rate up is important, but in an older patient, you don't want it to be going too fast. If you think it's getting too fast, maybe slow down your pace and take a break.
10 seconds.
So you get a lot of, great. So that's your number 3 workout in the high intensity training. So let's do a recap. You got the jumping jacks, and then you got the mountain climber, and then the ski jog. That's what you call it?
Ski jump.
Ski jump. Okay. So ski jump. Okay, that include the squats in built into that. So great. So what's the number 4 one?
So number 4 is a hard one. It's burpees. And you can do it with push-ups, but I'm just going to do regular ones. But I'll show you the push-up ones so you know what it is. Okay.
So that's burpees you're going to do, and they are a little bit harder. So if you can't do it, you can just do the push-ups. If you can do burpees, that's even better, depending on your skill level.
So you're going to jump up, go out. You can push up here, come in. Or you can do it without a push-up.
So you can do either with push-ups, make it a little bit harder, or you do without push-ups. So that's fantastic. So depending on your skill level. The exercise help you control weight, reduce your risk of heart disease, manage your blood sugar better. You can quit smoking if you exercise regularly. So, these are just a few of the benefits of doing exercises. Thank you, Jordan. That was number 4. So that was burpees, and you can either do with push-ups or without push-ups. So we got 4 out of 5, and you got the 5th one coming, right?
Sorry. It's a good workout. Make sure you're wearing comfortable shoes. That's very important. You want to have support for your feet. And also comfortable clothes. I've never did HIIT in scrubs, but it's really hard. The next thing is going to be lunge jumps or regular lunges. So my timer keeps going off.
So you got lunge jump or regular lunges, right?
Or you can kind of mix it up. Like if you can't keep going with the jumps, you can switch it up. So the regular lunge, you just go forward. And you want to make sure your knee doesn't go over your toe. It should be right above it.
Yeah.
And then if you're stuck, you just do this.
Yeah, that's a good pointer, Jordan, that the knee should not go beyond your toes. That's is an excellent pointer for the lunges. So if you're, having hard times quitting smoking, if you can do the, simple exercises which Jordan is teaching, that will help you, increase your chances of quitting smoking. We talked about benefit of all this on mental health. Your thinking, your learning, your judgment becomes sharper. So your risk for dementia get better with the high intensity interval training. And as you can see, there's no equipment involved. So basically, that's the nice part. Just your motivation, and you can watch Jordan's video over and over again. So that's your 5th one, Jordan?
Yes.
Okay. So basically, what you're saying is that anyone who can do 5 of those in 5 minutes, and then take a drink break, right? And then they can wait a minute or so, get their heart rate back, and do another 5 of the same routine, correct? And then if you really
in between each one, when you're starting out, I would definitely do like a 20 to 30 second break. So between jumping jacks and mountain climbers, do a break.
So in between the 2 exercises, take a break for 20 to 30 seconds, correct? And then once I'm sorry, go ahead.
Yeah, between each one, do a 20-second to 30-second break. And that gives your heart a chance to come down a little bit before you start the next one.
Right. And then in between the 2 big sets, like once you finish with the 5 one, maybe take a 1-minute break.
Yeah.
And, drink water or something. If you can. If you can't do it, just, stop there and then try building up after a few weeks to the second set, correct? Yeah, the goal is not to injure yourself. If you're going to injure yourself, then you're not going to do it. So build up slowly. Jordan has been doing it for a long time. So, it sounds very easy for her to do it. But if you're middle age or, your other side of the 60 and 70, or 80, it could be a little bit more challenging. So then you can start out, if you're not done it for a long time, don't start out with this routine. Maybe start out with the other routine which Jordan has on the YouTube, or where our YouTube channel. The chair exercises, start with simple things first and then build up to this. Anything else you want to add, Jordan?
I just wanted to say that I encourage that you try to exercise 30 minutes, 5 days a week. You can start slower, but that's what you want your goal to be.
So that's a good pointer, and a lot of good data on that. 30 minutes, 5 days a week does reduce your risk of heart disease and help you keep your weight down, keep your sugars down, improve your mental health. So, and if you think about it, we got 12 waking hours. So if we can put aside 30 minutes, that's not too much for the body to demand, that keep it in good shape. Right? All right, fantastic, Jordan. You always come up with great exercise routines, and we appreciate the work you do for our patients, and they all love you. Let me put some feedback we got. We got Joe saying, at FedEx, we stretch and flex to prevent injury. I think that's a fantastic that FedEx is encouraging its employees. I think it's a great employer to encourage. I think Mahajan Medical Center should do that too, make all the employees stretch in the morning. What you think of that idea, Jordan?
That'd be awesome.
Where is Debbie? Let's look at her face.
That's not fair.
No, Debbie has been walking the bridge, so she's not jumped from the bridge yet, so she's doing well. No, Debbie has been trying hard. So no, it will be great. I think that's great. The FedEx is doing that. Let's see who else we got. We got Marcy saying hi, Jordan. So let's see who else we got. We got our friend Ray Davis. He's saying hi to you and me. So thank you, Ray, for tuning in. So that was great, Jordan. And just as you mentioned, maybe stretch afterwards too.
Yeah.
You can go in deeper stretch, after you work out, because your muscles are warmed up, right?
Mm-hmm.
Yeah. So yeah, stretch before, drink your water in between, and stretch afterwards, right?
Yeah.
All right. So anything else you want to add, to what you talked? Hey guys, give Jordan 2 thumbs up and give her some love. She always come up with great routines. So if you have any questions, put in the comment section. She'll hang out, and we'll get on with the next program. Thank you, Jordan. Appreciate your help. Bye-bye. All right, we're back. So Jordan did a great job in terms of giving us perspective on exercise. If you look at the benefits of exercise, that's just mind-blowing how many benefits we have. And as we get older, I think we need all those benefits. So I talked about help weight control. We talked about reduces your risk of heart disease. And then we talked about manage your blood sugars and insulin level better. So if you're diabetic, if you do a little bit of exercise, start out with smaller 15 minutes a day, then build up to 20, then 30. You can reduce your amount of insulin you take. So that's a huge plus. Help you quit smoking. We talked about that. If you develop a good habit, it will help you get rid of the bad habits. So that's fantastic. It can improve your mental health. With COVID-19, anxiety levels are high. So the endorphins will help you, do better with the exercise. So that's good coping skills. Help you manage thinking, learning, judgment skill as we age. So in other words, risk of dementia will be less as we get into our older age. If you're younger, your executive decision making, your coping skills during your work will be better. Your stamina will be better. So that's all good. Let's see. What else we got here? Yes, so strengthen your bones and muscles. So if you have risk of osteoporosis, your mom is hunched over, your dad is hunched over as he got or she got older, then you can reduce the risk of osteoporosis by doing the exercises on regular basis. Um, and reduces risk of cancers. That's a good one. So a lot of cancers are because of truncal obesity, and like, for example, colorectal cancer, breast cancer, prostate cancer, pancreatic cancer. These cancers do go up as your weight goes up, and by doing exercises, you can improve your immune system and reduce your weight. So even if you have cancer, it will help you keep you in remission. So that's fantastic to work out if you are high risk for cancer or have cancers in your family. Reduce your risk of falls. We got a lot of elderly patients. So falls is a big anxiety and risk and can cause hip fracture and high mortality with fracture. So, by strengthening your muscles and improve your gait, by exercising, can reduce the risk of the falls. Improve your sleep. I think that's a very big thing we have with seniors, that they have difficulties having good quality sleep. Ambien and Restorils of the world does not improve your REM sleep or the quality of the sleep. Exercise does. So keep exercising, guys. It will get you good night's sleep. And even if you get 4 hours sleep with exercise, it will be good quality. We talked about sexual health and the effect of the exercise. So the exercise does improve testosterone in both men and women, and the muscles and the blood supply to our sexual organs improve. So men will have less ED if they exercise regularly, and women will have better satisfactory sex if they do exercise regularly. So that's fantastic. Who doesn't want to live longer? But not only longer, I think exercise or high intensity interval training for specifically do improve your quality of living. So it's fantastic that if we can introduce the exercise in our program, day-to-day routine. How can we make the routine better? So let's talk about that. How can we incorporate this? Make it part of everyday activity. And so example, if you're going to Publix, don't use your handicap parking permit. Park away in a parking slot and walk to the parking lot if you can. Get more active with your friends and family. So play football with your family, or tennis, racquetball, whatever. Just swim with your family. It's build bonds with the family along with the exercising for you and your family. And keep track of your progress. So Jordan mentioned about her Apple Watch. You can get that, or you can get any tracking watch. Check your steps. Just set up realistic goals, maybe 5,000 steps a day, and then build up to 8, maybe 10 in 6 months, a year. Or if you're already there, then add some dumbbells or weights to your steps. So by tracking, it's a human nature. Then you're making yourself accountable. And make the exercise more fun. If it's routine, then your exercise routine will fall off. Add some fun element to it, so that way it's not boring. What activities you can do if the weather is bad? Maybe walk in the mall. Maybe go to the gym, exercise there, or have some for the fallback. If you can have equipment at home, like a stationary bike or something like that. So that's good. So, if you can exercise anywhere, whether home or gym or indoor spaces, outdoor spaces, with family, without family, watching TV and your favorite show, and putting a stationary bike in front or rowing machine in front and doing the 30 minutes every day. Whatever you can do, or doing the high intensity interval training a couple of times a week, as Jordan taught us, along with the cardiovascular exercise a couple of times a week. All that will make a big difference in the things we talked about: our longevity, our quality of life, reduction in falls, our sexual health, our mental health. So it's a no-brainer that we should be doing the exercise on a regular basis. So, we talked yesterday in the teaser about the case of 16 women or friends who went to the birthday party, and then they all got COVID-19. I think I said Tampa. I think it was in Jacksonville. So, it's not gone, the COVID-19. I was reading an article, and some virologist was comparing COVID-19 with gravity. Gravity does not go away if we say it gone. COVID-19 is same way. It has its own weight, and we got to respect it. And 40% less transmission if we all wear masks. So I should be wearing masks for you, and you should be wearing masks for me. And it's not a political thing or anything. It's just simple thing of saying I care for you, and you say I care for you. And if we all care for each other and we can reduce the transmission by 40%, that's massive. Guys, we don't have a vaccine yet. We don't have a cure yet. And if you're young, you're going out to the restaurants, maybe you will get it, maybe you will get a mild disease, God willing. But God forbid you're asymptomatic and you interact with your parents or your grandparents, they have high mortality. They will end up in the hospital, they will end up in the ventilator, and God forbid they may die. And then you will live, and how is that? That the guilt you will carry that you gave it to your loved one. So please stay the course and keep the social distancing going. It's not gone yet. So I sound like broken record, and you guys are all doing it, I know, but pass it on to your friends. It's not a political thing. It's just that we got to do it. We got to do it for each other. So stay the course and wear your mask and wash your hands and keep your 6 feet distance. Stay away from the indoor spaces as much as you can. Stay away from intimate spaces as much as you can. Open the windows if you are with a friend's house and you have to be inside, or outdoor, meet people outdoor or do things outdoor. That's much safer, and it's good for you. It's good for the community. Otherwise, you look at Phoenix. I have a friend who's a infectious disease in Phoenix, and they have another huge hotspot like New York building up there. So no place is immune. It's just that as the lockdown is opening up and the economy is opening up, we got to be on our guard more. So just keep the course, guys, till we hopefully get a vaccine in a year or two or earlier. God only knows. But till then, or we get a good treatment with monoclonal antibodies is in the horizon. Even then, it's just you don't want to end up in a hospital. So if you can do simple things, it's worth doing it. Let's talk about the breathing exercise we're going to do today. It's called KapalaBhati exercise of from the core muscles of your belly. It's very simple. We went over that on last time, and we're going to do that again. So Ray mentioned that he's doing his recumbent bike while watching. Kudos to you, Ray. I think, we all need to learn from Ray that watching TV is good, but if we can do another activity with it, then you kill 2 birds with 1 stone. So fantastic, Ray. Keep up the good work. So the breathing exercise is KapalaBhati. We talked about it last time. It's a fantastic breathing. It's a breath of fire because it's a short burst, and it clears up your head, and you can do it before your other breathing exercise I taught you, which are a little bit slower. And KapalaBhati breathing is one of my favorite because, you will see why, because you're engaging your core muscles of your belly, which is a big muscle, and that helps you expand your lungs much better than your shallower muscles or the smaller muscle, the intercostal muscles of your chest or your neck. So how is it done? So let's have a look. So the KapalaBhati breathing is, done through your core, and you will put your hand just below your navel, about 2-3 fingers below, and you will feel the muscle there, and then you can exhale through that by pressing that muscle back, so towards your spine, so like this. So you're pressing the muscles and exhaling through your nose. And then inhalation is automatic. So it's like. So if you can do 1 breath a second, you will be able to get a good rhythm going. So do it with me for 20 times. So you just put your hand below your navel and feel that muscle contracting. And then don't use your shoulder muscles, your neck muscles in this exercise. Just use the muscles in your belly. So let's do that again. And this time, let's do it 20 times. Ready, set, and go. See, it was not that hard. So if you do that on regular basis, I think you will get a lot of benefit of expanding your lungs. If you have COPD, CHF, or just to help you calm your brain, it's a great workout. So keep doing this on regular basis, the breathing workout, and you will see the difference. You didn't get here overnight. The importance of breathing won't give you benefit overnight. So you got to practice that. With that, we're going to end our program. Be kind to yourself. Be kind to your fellow human beings and biospheres, and be nice to each other. Ciao. And thank you, Jordan, for chiming in today. She did a great job. Give her some thumbs up and wow today. And we'll be back on our next edition next Thursday at 4:30. We're going to have the CEO of Largo Medical Center, Adam Rudd, sitting with me, and he's going to be discussing the hospital CEO at Largo Med at CA. We'll be discussing their experience so far with COVID-19 and their expansion plans, and how is his experience going to help us, God forbid, if we get a second wave. So that's going to be very exciting. The CEO of Largo Med going to be talking with me on our next podcast on next Thursday. So do tune in. Till then, bye.